In fact, the whole coagulation process is simply about making the fibrin strand. So, let's define it properly. Coagulation is the process in which soluble fibrinogen is converted into the insoluble fibrin strands. That's it. That's the coagulation. Now, let's define the coagulation cascade, which is also called a coagulation sequence. It is a series of enzymatic steps or changes that convert inactive proenzyme or inactive clotting factor into the activated enzyme or activated clotting factor and result in the formation of thrombin. And this thrombin then converts the soluble plasma protein fibrinogen into the insoluble fibrin. The clotting factors that are involved in the coagulation cascade or coagulation sequence include factor 1, factor 2, factor 3, factor 4, factor 5, factor 7, factor 8, factor 9, factor 10, factor 11, factor 12 and factor 13. And yes, you heard it right. There is no factor 6. The blood coagulation system or the blood clotting system is classically divided into the intrinsic pathway and the extrinsic pathway. There is also a common pathway.